Hi, Dr. Ada here. I'd like to discuss some dietary supplement ingredients that I use in my practice for the treatment of overactive adrenal function due to chronic stress. Now, the adrenal glands produce a multitude of different hormones in response to physical and emotional stress. When stress becomes more chronic, the adrenal glands can actually hyperfunction and overproduce the stress hormones cortisol and adrenaline in response to stress, leading to symptoms of anxiety, sugar cravings, poor sleep, and the potential for weight gain. Now, luckily, in addition to diet and lifestyle modifications, there are dietary supplement ingredients that I will use in my practice with patients to aid in the management of this type of situation. Now, the first is a heavily researched and patented combination ingredient called Relora. Now, Relora is a powerful combination of Chinese herbs that include both philodendron and magnolia. Now, more recently, these herbs have been the focus of several studies which have scientifically proven their benefit. And we're going to talk about some of the types of patients that I may actually benefit from Relora. Now, people that don't tolerate stress very well or who have used to tolerate stress but find themselves very sensitive to it now. These people do great on this particular ingredient. People who suffer from racing mind at night or those with anxiety that prevents them from sleeping at night. People with food cravings, people that have depression or anxiety. And finally, people with high cortisol levels on a morning blood test. And finally, people who suffer from tension, depression, anger, fatigue, confusion, or lack of vigor. Many times patients will claim to feel wired but exhausted at the same time. That's where this product comes into play. The typical dosage that I recommend for this particular ingredient is around 350 milligrams 2 times a day or 700 milligrams before bed if sleep is an issue. Now, the next dietary supplement ingredient is that I will use in the case of overactive adrenals and the associated symptoms is called L-theanine. Now, L-theanine is an amino acid that impacts nerve impulses in the brain and the release of neurotransmitters, including one called GABA. Now, it is known that this is a natural anxiolytic because it can have a calming, sedative effect on the body and mind without making you feel drowsy, which is why it's often used to reduce anxiety, hyperactivity, and sleep-related problems. A good therapeutic dosage of L-theanine is around 100 milligrams 2 times a day or 200 milligrams before bed for sleep issues. I find that the combination of both Relora and L-theanine together is one of the best things that I can use with my patients that are dealing with symptoms associated with hyperadrenal functioning secondary to chronic physical and or emotional stress.